Talk a little bit about health equity in rural communities like Colquitt that you guys serve.
I guess the best example is a person with COPD, and you wonder why they might keep flipping back and being readmitted. Well, with health equities and with our system, we were able to build in 5 basic questions like, do you feel safe at home? Do you have money for food? Are you able to pay your rent? Are you able to keep utilities going? Well, we were able to build those into our questions that the nurses asked them, and then pinpoint what were some of the issues with health equity. And we found out food showed up in every single category as a problem, that people tend to not buy their medications because they're purchasing them food. Well, as a result of that data that we're able to get out of the questions, we started this food program with our foundation to where patients that are discharged, we send them home with food that weekend so that we can take care of their food. And then what we found was those patients that we were sent, we started on just one floor, and then we moved it to all the floors of the people that showed up as food as a problem. And that's where we were able to take some of the health equity questions and put it to actual application. Another example is in our pediatric unit. We found that patients that come into our emergency room, lots of times the doctor would say, okay, you can go home and do Pedialyte over the next 3 days and your child is going to be fine. Well, Pedialyte costs, I think, somewhere around $7.25 each. Well, what we found is that those mothers don't have $21 for 3 servings of that. So looking at the health equity data, we figured out that there was some problems with food and drugs. So we were able to put those patients in the hospital, which increased our admissions. But we actually were able to give them better in 1 day by giving them fluids overnight. And that all came about because of the health equity data that showed pediatric families have a difficulty either paying rent or with food.